Dr. Bettner. I'm one of the doctors at the All Saints Family Care Center here in Milwaukee. I want to talk today about high blood pressure, otherwise known as hypertension. So what is hypertension or elevated blood pressure? Well, we measure the pressure on the inside of the blood vessel wall. So the blood vessel, that's our arteries, our veins, all the tubes carrying blood to our different structures. So when we measure it, if you're less than 60 years old, any pressure higher than 140/90 is considered an elevated blood pressure reading. If you're above the age of 60, it's a reading of 150/90 or higher. So what do the numbers mean? You have your systolic blood pressure over your diastolic blood pressure. And the top number, which is the higher number, represents when the heart squeezes, it contracts and it pushes blood to the whole rest of your body. When the heart relaxes, it's filling up with blood. That measured pressure is the lower number. So for example, 120/80, that's your systolic over your diastolic blood pressure. So why do we care about blood pressure? Well, the cardiovascular system consists of our heart, which pumps blood to the whole rest of our body. Our organs, our kidneys, our brain, and every part of our body needs blood, and it needs to operate under this certain pressure. If those pressures are too high, it can cause damage to these structures. At the same time, if those pressures are too low, they're not getting the oxygen and the nutrients they need through the blood. So the first thing I'm going to talk about is what happens to the heart when it is pushing against a pressure that's higher than it likes. Well, what happens is it's over time beating. The heart beats between 60 and 100 times per minute, all day, all night, year after year. After years of pumping against a higher blood pressure, the heart muscle gets bigger and bigger and bigger. When we think of muscles, we think bigger muscle, good, right? Well, in the case of the heart, not really the case. What happens is the heart gets bigger and bigger and it outgrows its blood supply. So over time, the arteries feeding the heart aren't big enough to sustain the heart's larger size, and over time the heart muscle itself gets damaged, and down the line can get things like congestive heart failure because the heart stops functioning well. Next thing I want to talk about is plaque, and it's plaque inside the blood vessels. The fancy word for this is atherosclerosis. What happens is, year after year, plaque develops inside the blood vessels, and it basically causes these pipes carrying blood to get smaller and smaller and smaller. Now this deposition happens the older we get, but happens much more rapidly when things like elevated blood pressure, uncontrolled diabetes, tobacco use, poor diet that's heavy in salt, heavy in processed foods, fats, when people don't get exercise, all these things make it so that plaque develops much more rapidly. So moving forward from plaque, there are different processes that can happen related to the plaque. So the first thing I want to talk about is heart attack. Some people call this an MI, which stands for myocardial infarction. So what happens is the plaque inside the blood vessel feeding the heart ruptures. So you have this process where all the blood going to the heart inside this more narrow tube all of a sudden stops completely. The downstream tissue from where that blockage is stops getting oxygen and nutrients and basically dies. That's what a heart attack is. Next, I want to talk about strokes, and there are two kinds of strokes. One is just like the process in the heart with a heart attack, and the second one is the bleeding kind. So first I'm going to talk about the blockage kind. So just like in the heart, you have a plaque rupture, it stops the blood flow, and the downstream tissue then doesn't get the blood and oxygen it was getting before, and it causes the tissues to die. The second kind of stroke that we see with elevated blood pressures is the bleeding stroke, is where after years and years of blood pressure being higher than the blood vessels can handle, in the brain you get sort of like a balloon that gets bigger and bigger and can eventually pop. This causes a bleed inside the brain, and this can be very harmful and it can be fatal. Next thing I want to talk about is the kidneys and their relation to blood pressure and elevated blood pressure. So what the kidneys do is they filter blood, and they keep the blood clean and basically balanced of all the different components. This microfiltration system is delicate, and if it's operating under pressures that are higher than what it prefers year after year, it damages the kidneys, and eventually the kidneys can stop working.